After introductions, we're going to be turning this over to audience Q&A for the remainder of the meeting. Questions will be taken in written and oral form. So we have these note cards. And Kate, a league volunteer over here, if you'd like one, just simply raise your hand. If you'd like it picked up, raise your hand again and she'll get it from you. We will also be coming up for oral questions to the microphone up here after introduction, so just simply line up and we'll be taking questions alternating between written and oral. Please remember to make a question. If longer statements are being made without going towards a question, we may be interrupting and cutting you off. If your questions are not addressed today, we always encourage you to reach out to your legislators directly. The state legislators that represent the greater Corvallis area were each invited, including Representatives Dan Rayfield and Shelley Boshart-Davis. And we also, you might see there's an empty space right next to Sara Gelser here. Mike Neerman was anticipated in attending, and hopefully he'll be walking through the door at some point in time. But if not, the focus will be on Senator Gelser here. And as session continues, actually, let me just say that Representative Rayfield was unable to attend today, but he is also having a community coffee on March 23rd at 9 to 10 a.m. at Old World Deli. And there's also a education-specific forum that he is putting together with details coming as well. And if you have any questions, talk to his staff representative, Tony, here in the back. And he'll be here afterwards as well if you'd like to answer questions or talk. As session continues, we will be continuing these monthly town hall meetings. The next two are on April 6th and May 4th. And now I'd like to introduce you to our legislator here today with us. Senator Sara Gelser, Democrat representing District 8. Senator Gelser is the chair of the Senate Committee on Human Services. She's also on the Senate Committee on Education and the Senate Committee on Judiciary, the Joint Committee on Transportation, and the Joint Interim Task Force on Testing of Sexual Assault Forensic Evidence Kits. So Senator Gelser, you know, it's Saturday morning. Sarah.
Hey, you.
Yeah, exactly. Any of those. Sarah, welcome. Thank you for attending. And first, I just ask you to do a brief introduction, include an overview of any specific legislation that is really important to you during this session. And then, like I said, we're going to hand it over to Q&A.
Well,
Better. Good morning. Thank you all so much for taking time to come today. And I also wanted to clarify for Representative Rayfield, the reason he's not able to come today is that the Budgetary Ways and Means Roadshow starts this weekend. And that is where the Budget Committee travels around the state to take input from citizens about what our budget priorities should be. So they have their first hearing today is it in Coos Bay?
Yes.
Tony? Yes.
Coos Bay this weekend, Pendleton next Friday, Redmond the following Saturday, and then Portland the Thursday after that, so he's traveling a lot.
Yeah, so there's a lot of traveling for that committee, and Representative Boshart-Davis, I was just with her this morning at our local government breakfast, but she has been on the Joint Committee on Carbon Reduction, and that committee has also been traveling all over the state. So she's not had the opportunity to be home to see her kids for a couple of weekends, and very little of her district is here. So I wholly endorse her getting reacquainted with her daughters this morning, but she sends her best as well. Certainly, I think as the legislature has really tried to figure out how to be more inclusive of people all across the state, we've really made an effort to put legislators on the road to go to where people are at. And I am really grateful to the families that support all of us in being able to do that and take time away from them to go and do that important work of hearing from people. So we are at week, I think this month, what was this, Tony, week 6? Was this week 6, week 7?
Feels like 30.
Feels like 30, but we're partway in. I think next week, by the end of this week, the panic started to set in because we're edging up on what we know is our first chamber deadline. So by the end of the month, any bill that is going to stay alive has to be scheduled for a work session in the policy committee in its first chamber. And it has to be ready to go and voted out of that committee by, I believe, April 7th or 8th. So we're really, really getting close to that. And so what that looks like in my office is, one, trying to manage all of the negotiations about all of the bills that are sitting in my committee that are important to people and organizations, and getting them ready so we can keep them moving. And then also working on my own bills that are in everybody else's committee to make sure that they are good to go and approved. I think there have been a lot of jokes about me among my colleagues over the past, because I have a lot of bills. These are all just mine that I'm responsible for. There are about 85 of them, and that's before my committee. So I proactively went and killed off some of my own bills yesterday because I decided they were too hungry and I couldn't keep them all alive. So some of them just had to go into the pile for better luck next time. A number of the bills the fortunate thing is a lot of my bills tend to land in human services and education and judiciary, which are committees on which I sit. So that helps a lot, because when your bills are up in a committee you're not on, you have to leave the committee which you are serving to go and listen to those other issues. But the Department of Justice has now started making fun of me because I have so many judiciary related bills that their legislative coordinator, I'm the only legislator that has a file in between general judiciary and guns is Gelser. A whole series of my bills. So we check in weekly, and they are very helpful at making sure that we're complying with the Constitution. So I'll give you an update on a couple of these that we are working on. We've got legislation kind of clarifying the way that physical touch can be used at school when managing behavior. We passed a bill prohibiting the use of seclusion and restraint in public schools in 2011. That was my bill. And the idea was to stop these very dangerous types of restraints that were primarily being applied to students with disabilities. As the years have gone on, there's been a lot of confusion about what that meant. The legislation was never intended to prevent someone from saving a child from being hit by a car, for instance, to go out and grab them and pull them back in, or to put a hand on a shoulder and guide somebody out. So there has been a lot of discussion about how to clarify that language to allow appropriate discretion, but also not to allow really vulnerable kids to be hurt in the way they have in the past. And I was really proud to be able to bring together the Oregon Education Association and Disability Rights Oregon, and they have a bill, it's now Senate Bill 963, that they are both excited about, that restores some authority to teachers, but also clearly prohibits very dangerous types of restraints that we were trying to get at in the first place. And what's really exciting about it is sometimes you can introduce a bill at the request of, and this bill right at the top says at the request of Disability Rights Oregon and the Oregon Education Association, which is, I'm now calling it the unicorn bill, because that is a very difficult partnership to pull together, and it has gotten some national attention because this is an issue that many states are wrestling with. And the National Education Association contacted our Oregon Teachers Union to say, hey, how did you get on the same page? Teach us your ways. So I'm very proud and hope that this is another way that we can help other states move forward. We also have legislation that's going to improve the way that investigations take place for abuse that's alleged to occur at school, either between students or from school personnel to kids. This is an exciting collaboration between the Department of Human Services, district attorneys, and our school districts. And it's been a mystery that we've been working on since about 2009, and finally the pieces are coming together. And that's going to be in two bills, Senate Bill 155 and Senate Bill 960. We have moved the first pieces of continuing our efforts towards suicide prevention, especially youth suicide prevention. Last week we passed off the bill Addie's Act, which will have, each high school have a comprehensive policy as it relates to dealing with the needs of kids that may be at risk of suicide. We also passed off the floor an update to legislation that I introduced a few years ago that has to do with the health department communicating with schools and other youth-serving organizations to get information about youth fatality related to suicide up to the Oregon Health Authority. And then the Oregon Health Authority provides post-mention resources. And this will make that smoother. we'll also have on the floor within the next week or so, and this was a request that came out of Lynn County on behalf of a bunch of other counties, to expand the information that they can share so that we can really identify kids that need support and help after they have lost a friend to suicide. And then finally, we've got Senate Bill 707, which is going to take the Youth Suicide Alliance, which is back in 2013, in this community, we had a rash, we had a cluster of suicides. We lost a number of young people. We still commemorate every year Lily. We've got Lily's Lope for Hope in Philomath. And following that, we introduced legislation that created Oregon's first youth suicide intervention and prevention coordinator on the health services side of the Oregon Health Authority. She was amazing, developed a 5-year youth suicide prevention plan, and developed this alliance, this Oregon Youth Suicide Alliance that has been incredibly active, well organized. They've had very good legislation coming forward each session. So we have a bill to make that permanent, to put that alliance into statute, because that amazing person that led all of this just retired. And we know that work can't be just dependent on a single person. We have to kind of institutionalize and memorialize that work. I have legislation that's moving around jails and prisons. There's a bill to reduce the costs of telephone calls for people that are in our jails and prisons. Right now, those rates tend to be very high and the quality of the phone calls quite poor. And we know that that impacts the ability for people to comply with their plan and to safely reintegrate and reunify with their families. We also, I have a bill that will be coming off the floor soon that will ensure that all prison inmates have the opportunity to have a flu vaccine every year. They can decline it. They don't have to get one if they don't want to. But the practice until now has been to only order less than really about a third of what would be needed for full vaccination, and people had to go onto a prioritized list and go through a pretty big process that was difficult to access those. And we actually ended up with a death at Coffee Creek after a flu outbreak last year. So we'll be moving that forward. And then we have another one that will prohibit the use of dogs for cell extraction and intimidation of inmates and patients, so that it can't be comply with me and you've got this growling, lunging pair of German Shepherds, or I'll turn the dog out on you. And we had some pretty disturbing video of this happening in a Columbia County jail where the person was terrified and didn't move, and they let the dog go, and you just watch the dog totally mauling the individual, and that's not right. We shouldn't be doing that. I have a bill that's moving forward to the Budget Committee that would lower the required grade point average for participation in the Oregon Promise, which is free community college. Right now, you have to have a 2.5 GPA in high school to be eligible for that. We're going to lower that to a 2.0. That is what we think will really get us bringing in more college-going kids. Just a couple more things here. Obviously, I'm supporting and I'm signed on to a number of the really big bills, like paid family leave. I'm very excited about the Clean Energy Jobs bill, whose name keeps changing. I think we're currently at Clean Energy Jobs. I have a bill in for Diana Allen that will help us make sure that when a person is in an assisted living facility and the care levels in that facility change, that appropriate notification is given to residents and family members so that if they need to move to have appropriate care, they're not just shoved out with no plan, and people have a better understanding of what's available to them, and there aren't surprises or coercion. And then we also have some legislation around there have been a number of cases where people who are caring for vulnerable people as employees have gone to make a report or have either failed to make a report at all to a hotline, an abuse hotline, or have made a report to a hotline and then made to be believed that they could be sued because they were subject to some sort of a non-disclosure policy from their employer. So the best example of this was there was a daycare facility in the Portland area where somebody was hired by this daycare facility. She immediately noticed that every day they were, I'm not making this up, tying up the babies and putting them in the basement at bedtime. So that's not at nap time. And so this new worker appropriately called the child abuse hotline and said they're tying up babies in this basement. And then they had a very difficult time getting her to cooperate because the provider, the owner of the daycare, found out that she had called and threatened her with a lawsuit and said that she had was not allowed to report those because she was subject to a non-disclosure agreement, which she was not. So we have a bill that says whether it's a child care program, an assisted living facility, a nursing home, a foster home, adult or child, that an employer cannot either force someone, ask someone to sign some sort of a non-disclosure policy, agreement, have a non-disclosure policy, or cause someone to believe that one exists that would prevent them from making reports of concerns about the health, welfare, and safety of the people that they're caring for. So I'm excited about that bill. I think it's pretty important. And then there's a lot of other stuff, but there's a series of bills related to workplace harassment that we're moving through. Mine are primarily focused on public employers. I've also signed on with Senator Taylor and Senator Knoop for a broader one that will impact every employer in the state. And it has some pretty exciting provisions in it. It makes very clear the responsibility of employers to be proactive. It creates some accountability for individual supervisors, directors, or owners that have knowledge of harassment but fail to take action. It would assign liability to them in that case, which is not something that currently exists. So it's kind of looking at that idea of assisting the harasser in addition to just being the harasser overall. It also will eliminate non-disclosure agreements unless they are asked for by the aggrieved party, and will eliminate these no hire provisions. Because a lot of times what happens right now is a person will go through a complaint, they'll find that the harassment occurred, and then the person that was the victim of the harassment, they will pay them some money, have them as in exchange for that agree to leave the workplace, never be hired by that corporation or company or network or government entity ever again, and they're never allowed to talk about it. That's just, and the harasser then stays. That's just not right, and we are going to end that. I also have a bill along with Senator Knoop that would eliminate the ability of using public funds or campaign funds or third-party funds to buy silence about misbehavior in order to benefit a political campaign. And that we've had to be very careful about how we thread that needle because there's some constitutional questions there, but it basically would be if I decided I was going to run for office and I knew that Cliff Trow knew that I did really bad things when I was his student, and I called him up the month before I filed for office and said, Cliff, I'm going to pay you $1 million, and in exchange for that you can never talk about all the bad things I did over at Milam Hall. That would be, I would have to disclose that as a campaign contribution and say what it was for. I'm really kind of excited about that. I think that'll be pretty fun. And then in the public funds for this buying silence for if you're like a public employer or an elected official, we're expanding what the definition of consideration or payment is. People tend to think of that just as, I'm going to pay you $10,000, I'm just making up a number. It's often never talk about it again. We are making clear that it's not just a payment. It could be an extended work from home agreement where you're not actually working but you're still getting salary benefits. It could be an extremely generous severance package when you have voluntarily resigned or been fired without cause. And you would not be able to, in doing any of these things when a person is leaving a public employer, have them sign a statement that says they are signing away all of their claims against you for any of your rights they may have violated while you worked for them. There is absolutely no reason when a person resigns voluntarily and they've done nothing wrong from a public employer to do that. And I have recently learned and been told, because this happened in our presiding officer's office, that this is just standard practice. If that is standard practice, it needs to not be standard practice anymore. We cannot pay people to be quiet about things that happen to them because that makes it nearly impossible to hold public officials accountable. And that leads into the last piece. This whole issue of workplace harassment in the Oregon State Capitol has been going on for oh my gosh, I feel like this conversation has been going on for my entire lifetime now. And unfortunately, it's not a conversation that we can stop having. But this week there was a settlement that was reached in the complaint that the former labor commissioner brought against the legislature on behalf of 4 women, 2 interns whose names they have revealed themselves. Their names are Annie and Adriana. They are extraordinary young attorneys. And 2 staffers, one of whom has now revealed herself. Her name is Audrey Meschling, and another that is still anonymous. Those 4 women went to the labor commissioner, which was an avenue of redress available to them, made a complaint. The labor commission aggressively investigated that. And because those 4 women were willing to take that risk and stand against the entire legislature, they opened the door to this settlement, which brought remedy to an additional 4 women. So the settlement was, the total dollar amount in the settlement was $1.3 million. Just over $1 million of that is non-economic damages to 8 women. I am not one of those 8 women, but 8 women with multiple perpetrators. So both in terms of the dollar amount, the number of victims, the number of perpetrators is very, very significant. I did receive reimbursement for my legal fees. I had told about and paid out about $26,000 in legal costs to pursue my complaint, to have Jeff Cruz leave the legislature so that he was no longer harming women, and then to comply with the subpoena from Boley and go through my deposition and all of those other things. So I was very grateful to have that back, but I did not request any remedy. And then several $100,000 in attorney fees for Boley. What's not included in that amount are the legal fees that the legislature paid. The legislature, as of the last invoice, was close to $300,000 in legal fees just from the time of the Boley complaint forward, and that does not have the last month of services inside of it. That to me is something that should be concerning to everybody. Those are taxpayer dollars. The settlement was announced the same day we learned that we have a budget that involves reductions to programs that we all share. And again, in the big scheme of things of school budgets and everything else, $1 million isn't necessarily going to cut class size or solve any of these major problems. But you should expect us to manage our affairs better. We should manage our personnel better. We should manage our workplace better. We should not be at a place where we have to go and have these settlements. And it's not about responding to a crisis or a complaint when it happens. It's about the things that happen in our workplace every single day. And when people raise the issues, treating them with respect. That one of the issues that came up in the Boley complaint, and it was certainly true in my experience, was how awful it was to go through the experience and be shamed and silenced by the people that were in charge in the building of our complaint and harassment process. And I think it is entirely fair for members of the public to be asking the legislature, how did it happen that you violated the law, allowed these terrible things to happen to these interns, have to pay out, by the time all the legal fees are tabulated, close to $2 million, and everybody still has their job. Why Dexter Johnson, the legislative counsel, still has his job in the Oregon legislature is one of the great mysteries of the 21st century. And we have to have some accountability for these women, or we don't change it. Really grateful. We're going to keep working on some of the Law Commission recommendations. Some of those are very good. Some of them need work. But we don't fix the problem until we fix the culture. And it's not just sexual harassment, it's racial harassment. And we also have to recognize that now that people see that there is remedy, this is a pervasive problem in the Capitol, and I expect we will see a number of more lawsuits come forward, which will be embarrassing, and they will detail names of members and other people, and will probably also lead to settlements. So we need to get a hold of this, honor the people who have been harmed in the past, take accountability and apologize for that, which the House has done. Our Senate leadership has thus far been disappointing in that regard. We need to see stronger, better leadership, that this is unacceptable and that it's not a distraction. Last thing about that, over and over again, I'm told these 2 things. One, elected officials aren't governed by the same laws as everybody else, and you can't just, not a CEO of a company, I can't just get rid of someone. That is an unacceptable answer because it is not appropriate to say that as a condition of working in the legislature, you have to accept workplace harassment. We as legislators have political tools that we can use. Can you just fire someone? No. But can a presiding officer stand at the dais and say, I demand your resignation? Yes. Can a caucus leader make a motion from the floor to censure or expel a member? Yes. Could all of the members of the legislature of a chamber come together, Democrats and Republicans, and say, we have information that shows this person is actually harming people, that's not acceptable to us, we demand a resignation? Yes. There are political consequences to that. It disrupts the systems of power, the lines of power, and the structure of the institution. And that's why people don't do it. It is not appropriate to expect our workforce to shoulder the burdens of harassment in order to protect power and privilege in the legislature. And that's what we've done by not being willing to use our political tools to make that happen. The last thing is, why do we have to keep talking about this when we have really great things that we can do with our Democratic supermajority, and talking about this and addressing these issues will kill that agenda? One, that's not true. We can do both. We can walk and chew gum at the same time. And two, it is not acceptable to me that we would say to people that have been harmed that they are taking up too much space by speaking about those harms. It is not acceptable to me that we would leave human lives as rubble and collateral damage in the pursuit of a progressive agenda. To me, that wouldn't be a progressive agenda at all, and I'm not willing to do that. Fortunately, like I said, we can do both, but we can't stop talking about this until it's fixed. And with that, I will answer any questions. If I seem a little mad,
So as we start with questions, we'll start with a written one. But if you would like to start coming up and have any questions that you would like to address to Sara, please start a line, a queue right up here at the microphone. And let's see, start with the first ones we got this morning, which this actually, the first question had been for Rachel, but also addressed to the others, it said as well. So do you support, this would be Senate Joint Resolution 13 on a paid signature gathering or campaign finance, or what? Also, what are your campaign finance priorities, which you've spoken a little bit about? But
sure. So I have not seen that one, so I cannot speak to it. We've got the non-disclosure money. I will look it up though. There are just about 2,000 bills right now, so we haven't seen them, and I'm not on that committee. I do have a bill that I've sponsored along with Senator Golden that is sitting in Senator Golden's campaign finance committee. And this bill, there's something that's called an independent expenditure, where I really want to help Stuart. Stuart may or may not want me to help him. So I just spend a lot of money to help Stuart, but I never talk to him about it. I don't coordinate with him. I don't coordinate with his campaign. He just one day goes to his mailbox and he finds that I have mailed this glossy flyer that says how wonderful his apple pies are, and that everybody should be eating the Stuart Wershow apple pies. And he doesn't have to report that as a campaign contribution because he didn't know what was happening. He had no control over it, and he couldn't even stop it from happening if he didn't want to. Now, where I think that gets, I have a lot of issues with independent expenditures in general, because I think we can hide things in a lot of ways, and there are a lot of bills to address that. I think Representative Rayfield has one. But where I think it gets really tricky is our caucus PACs, our political committees for our caucuses engage in independent expenditures for races that are taking place in their own chamber. And I just think that is an enormous stretch of the imagination that there is no coordination, because those are our candidates. In some cases, this happens when caucus PAC, so it could be, ours is called the Senate Democratic Leadership Fund. Senate Democratic Leadership Fund doesn't agree with how a candidate is running their campaign. They think that that candidate should be sending a lot of negative ads, and the candidate doesn't want to send a lot of negative ads. So they send them anyway, and the candidate has to deal with that in their community. Or alternately, candidate doesn't want to be held responsible for sending these negative ads, so the caucus sends out the negative ads, the candidate rejects denounces them, and then both gets the benefit of the negative ad and of denouncing the negative ad. That really doesn't make any sense. So Senator Golden's bill and my bill just says caucuses cannot engage in independent expenditures for races within their own chamber, period. Other people can, individuals can, and also the staff of those caucuses cannot provide coordination or technical support to those organizations. This will be very controversial, but Senator Golden and I thought it was worth a try and a discussion.
All right, we'll go to an oral question.
My name is Karen Josephson, and I would like to tell you the bill that I would like you to support and where it is in the process. And then I would like to say just one or two sentences, because this is not something very many people know anything about. It's Senate Bill 283, relating to exposure of radiation in the schools. And I so appreciate everything you've said to us today. I was just making notes. It's human rights, accountability, harassment, safety, abuse prevention, ethical, trying to true our culture to where we should just be as human beings. And so I have confidence that if you really knew the information about radiation in kids, the lack of safety of Wi-Fi and computers in the presence of children, I feel strongly you would stand up for that. The trouble is, if you go to Google any information about this, they're going to say cell phones are fine, Wi-Fi is fine, because all of that information comes right from the telecommunications industry, and it looks like good science, and it isn't. And the FCC, who creates the standards, has standards hundreds of times higher than what we need to have the standard way down here as to what's acceptable for radiation. But it's clear up here because the FCC is a totally captured agency by the telecommunications. So I'm wondering if you would support that. If you had, I could give you plenty of independent science, not from the World Health Organization, parts of that, not from American Cancer Society, because they have all followed along with the FCC.
So I have not done work on that bill, but my understanding is that it's been assigned to the Education Committee and we'll be having a hearing, and I sit on that committee. So I can't say where I am on the bill until we've sat and heard the presentation. I know there are a lot of people that are working on it, and I'm looking forward to the hearing and learning more.
So it's now in Joint Ways and Means. Does that mean it's going to die? Joint Ways and Means, yeah. It now went from Education Committee to the I looked it up last night. It's in the Joint Ways and Means Committee of the subcommittee of the Education.
Let me look at, Tony, can you look that? Would you please look that up? Okay. I think it might have a subsequent referral to Joint Ways and Means that after we worked on it in education, it would then go to the Joint Ways and Means Committee that would look at it for budget things. But I believe it's still sitting. Good. And sorry to bother you with that, Tony. You always know everything.
Thank you.
Thank you.
Great, thank you. You already spoke a little bit about community colleges. This is another question on that realm. What is your view of community colleges offering four-year degrees to make a four-year degree more accessible?
So four-year degrees should be accessible to everyone. I have some nervousness about that, but it was important to a number of our colleagues to forward that conversation. It came through our committee. Our community colleges are really stretched right now. They are working so hard to be, they really are a foundation of education, economic opportunity for everybody, for people of all ages. And I want to make sure that we're not diluting that resource. At the same time, our institutions of higher education are also really struggling, and we need to look at how we are making this blend. And then the third piece is higher education is becoming ever more out of reach for people because of the cost. And so that, to me, that was as I was teetering more choices and more avenues, it seems like a smart way to go. But we'll see where the rest of this conversation goes now that it's over in the House. I know it's been a bill that's been important for the Senate President for a long time.
Hello.
Hello.
My name is Brianna. I brought my daughter with me. She is 6. Can you wave, Ellie? And I also brought her best friend.
My name is Ellie too.
And I brought her best friend McKenna. Sorry, I feel like I'm crouching over here. Anyway, I am here to talk to you about House Bill 3063, the one that is taking away vaccine exemptions for children and not allowing them a public education if they do not comply with the Oregon Health Authority's schedule. So the issue, I know that you're not currently sitting on the board, but they did start there's going to be not a hearing, a work session for it next week. So I'm not sure at what point it will get to you, depending, I think it goes to Ways and Means if it passes.
I'm not, that one might not go to Ways
Okay.
and Means, it might,
What's the number?
3063, the vaccine bill, do you know if that has a subsequent to,
I'm not off the top of my head, but I can look.
Tony's gonna look.
Oh,
I
okay,
think your
so,
question, he will know the answer.
Anyway, the biggest issue that I have with this is the fact that it's going to deny my children an education within the public sector. So my son currently goes to Montessori school. He is 3. He will no longer be able to attend. My daughter currently goes to Albany Christian. She also will not be able to attend. She will also not be able to go to any church, nor will my son, that has a daycare or a school on their premise. Almost all churches have a daycare on premise for children so that they're not disrupting. She will not be able to go. She will not be able to go to the Beauty and the Beast production that we're going to go to after this because it is at the high school. She will not be able to participate in any sports that are in a gymnasium that are within the school. She is going to be segregated against because of her vaccination status. And I was just wondering, so here's my question, how you feel about this and the bill in particular.
So there was a hearing, was that last week, the week before last? I have never seen so many children in the Capitol on one day, and I happen to really like children, so that was really fun. So if you were in the Capitol that day, girls, it was really great to have so many kids and families there. And the line went, if you've ever been to the Capitol, the hearing room, all the way from the House side to the Senate side, people lined up, and all of the gathering places where there's televisions to watch were just lots of families and children. So it was it definitely drew a great deal of interest. I happen to believe that that vaccines work and that they're very important as a public health strategy. I also believe there are some people that can't have vaccines for medical reasons, and it's really important that those individuals be able to not have vaccines, and that's why a medical exemption is incredibly important. The more people that don't vaccinate without a medical reason, the less safe those people that have medical reasons are. And that's where you end up with this challenge. One of the things that I wondered about, and I started a conversation with Senator Steiner Hayward about this probably 2 days ago or 3 days ago after some questions that I got at my Tuesday night town hall, was whether or not the process for a medical exemption is accessible enough to families. Do individual pediatricians and family physicians have enough authority to make a decision about creating a medical exemption when there's a child in a family that has had a bad reaction to a vaccine? I have a brother that had a bad reaction to a vaccine, or and what happens to those siblings after that, and if that might be some of the challenge. The other question that I had for her was, I wanted to better understand what is the list of what's actually required. I mean, there's a whole list of things that I think are important and that I get for my kids, but do we have the right list for what's required for enrollment in school? And the reason that those enrollment pieces for childcare and other places are there is just because of the public health aspect of that. I would want to clarify that I don't think you would be prohibited from going to Beauty and the Beast. It's enrollment. So you would not be enrolling in Corvallis High School by attending a play or a basketball game. But you are absolutely right. It would if a person didn't have the required vaccinations and a medical exemption, it would preclude enrollment.
Can I ask a clarification question on that? So then how is it that she wouldn't be able to attend a church with a daycare or a childcare on it, but she could go to a, let's say, basketball game at the high school?
So I believe that, and that's something that I've been trying to track down since Tuesday night as well. That was a new one. I believe that it is a childcare that is at a church or any other location. You wouldn't be able to enroll. The place that the vaccine kind of the disenrollment happens is when you are enrolling in a program. You're enrolling in a childcare. You are going into a foster home. You are going to a camp. It's that enrollment point. But in terms of places of public accommodation, going to the library, going to the hospital, going to a basketball game, there isn't even a way. I mean, there wouldn't even be a way to enforce that.
That's
so,
the question that I have.
yeah, so I don't, and I'm trying to get more information on that church piece because I heard that the first time, and I don't believe it's in the bill, but I'm trying to understand why people believe that it is, so that if there's a way to clarify that with what it looks like. Now, I know that's not going to resolve your other issues about the actual enrollment, Oh, they're fine. Kids should be seen and heard every place. So,
I've read the bill and it says 8 building including those things within it. So that's.
yeah, so I will look at it more carefully. It's not in my chamber yet, so I haven't looked at it very carefully. But the honest answer is I do believe that we should be having widespread vaccination. I do want to look and make sure that we are choosing the right ones in terms of enrollment, and that our materials correctly reflect, you know, kind of this difference between, I've done some vaccines, but not all of the vaccines. I don't know that we should list that as unvaccinated. I mean, that's different than wholly unvaccinated. So I would like the system to be more accessible and understandable, and I want to make sure that access to a medical vaccine when there's a problem, a medical exemption when there is a problem, is accessible. But I am a person that does believe that that vaccination is important as a public health strategy.
Thank you.
Great, we have several questions here written about House Bill 2020. And know that it's in the House, but would be interested in knowing, I guess the questions are there any changes you would make to make it better? And what is the status and standing, and do you anticipate it to go forward?
So, House Bill 2020, did I bring my 2020 cheat sheet? We just got an update. I do not think I brought my cheat sheet with me. That would have been smart. So it is in a joint committee, so it's being heard jointly by the House and the Senate. They just finished their tour of the state, and I know that Rep. Bostrick Davis, who's actually on the Carbon Committee this morning, said that they've just uploaded about 1,500 individual pieces of testimony to the bill. I am not sitting on that committee, and so I am not sure at this moment what changes they are looking at in the program. I would like to see the bill move forward. I think that the general structure of it is going in the right direction. I think that they are trying to make some refinements to respond to the criticisms and concerns that they've heard from folks out there, but I need to wait to see what the final version of the bill is. What I do think is important when we talk about clean energy jobs and carbon reduction to address climate, I think it's irresponsible and unfair for us to say that it's easy. I mean, if we're talking about reversing the human impact on climate, that's not easy. I mean, that's a fundamental change of the way that we do things. And when we do some things different, that means it's going to be harder and more expensive. Because if it wasn't, we would already be doing it that way anyway. So as we talk about this, I think it's really important that we recognize that there will be some increased costs and there will be some inconvenience in the process. Otherwise, we probably wouldn't be doing something that was meaningful. And ultimately, we need to make sure that we all share that shift and look at the things that we all do in our individual lives as well that impact carbon emissions.
Thank you.
Good morning. My name is Diana Allen, and trying to make this into a question is about Senate Bill 917, the non-disclosure one. And I think, you know, it's difficult at times to operationalize policy at a local level, and I think the non-disclosure clarification that it's not allowed is a good start. What can we do, or my concern is around increasing accountability and understanding of caregivers that they are mandatory reporters. And I'm specifically thinking right now of long-term settings, care settings, that they are mandatory reporters, but there's not a whole lot of meat around it. And maybe the non-disclosure thing will help. Do you have any thoughts about that? Comments?
So I think a lot of it has to do with training. And one of the issues that came up when we heard 917 on Thursday was that, one, we need an amendment to the bill because it refers to treatment, which sounds like medical care, which is not HIPAA compliant. So we need to find a better word to make sure we're not violating anyone's privacy. But we train so hard around HIPAA compliance and privacy that I think we frighten people into thinking they're breaking a law by sharing information. So we need to look at how we're training people to differentiate between a treatment plan and abuse or neglect, and that is never, ever prohibited.
Let's see. Senate Bill 409, do you support being able to get lower priced drugs from Canada?
Yes, and I am a co-sponsor of that one. I'll vote yes.
Hi, good morning. My name is Javier Nieto. I'm the Dean of the College of Public Health and Human Sciences here at OSU. And I just wanted to thank you for your support of the statewide, which are critical for continuing long-term mission of the university and broadening our communities in both rural and urban areas across the state. As you know, we have an initiative on community health and resilience, and I really appreciate your support and look forward to continue working with you.
Thank you, likewise.
Is there a move to hold individuals accountable financially for harassment in the legislature? You spoke kind of on this, but if you had any other thoughts to share.
Yeah, so currently I'm not aware of any move. There are some people in the legislature that are currently named in civil actions. I think only one of those is left because the two, they're referred to as the interns. They're now both attorneys, but the two women that were interns had filed claims against the legislature, and they dropped those as part of the settlement agreement. It's difficult to compel individuals to take responsibility and comply with a fine or a fee. So a really good example of that, and oddly it's again Senator Cruz, there was an issue, we all know about the Indoor Clean Air Act. You can't smoke in a public accommodation. But Senator Cruz really liked to smoke in his office. And it was a problem, and people kept complaining, and they kept going to the health authority. And the health authority would issue a fine, and the legislature had to pay the fine. So over and over again, taxpayers paid the fine for an individual violating the Clean Air Act, and never were we able to find a way to have that fine applied to the individual that was doing the smoking rather than all of the taxpayers. So that is something we really need to figure out, because we should all be accountable for our own actions. That said, the legislature is an entity and it is an employer, and there are different types of liability. There's the liability for the individual that does the bad thing, but in this case, the legislature as an employer failed in our duties for employment, and that's why I have the question about kind of human resources and legislative counsel, the people that should have led us to manage these things appropriately over a number of years didn't, and I think that's a measure of accountability we need to look at.
Thank you. Welcome.
Hi, my name's Peter Ringo. I live in Corvallis, and I was there at the other town hall in Albany. First of all, I want to thank you for your work on child abuse and suicide rates. I just learned that today. I don't know all of the things you do, so I'm really glad for that. And on workplace sexual harassment. I also want to thank you, which I just learned about today, that you are having serious conversations about the access to medical exemptions from vaccines, because I see that as a problem. I think a lot of people have a problem with that. I'm wondering if you have had an opportunity, or your aides had an opportunity to look at data from comparing disease, death from disease, and serious complications from disease to vaccine adverse events and deaths. And if you have had an opportunity to access CDC databases on those things, because it can inform maybe. I just want to use an example here. This is measles, deaths from measles for the last 20 years, and deaths from the MMR, the measles rubella vaccine, and plus the one with chickenpox now. And the comparison in the last 20 years, deaths reported for the measles were 12, and the deaths reported for the vaccine were 183. So I want to use this as an example to address the problems with medical exemptions. You can't always, first of all, this is an example of what can happen if you can't anticipate. And the science is not to the point where we can anticipate every injury or death from a vaccine. So first of all, the science needs to be better, but also that physicians can recognize perhaps early events and then exempt a child that could have a worse event later. So I just want to know if you are getting some backup on statistics to learn more about those problems?
So I am not on the healthcare committee, and
Okay.
my workload is overdone. So
Sure.
I
Yeah.
am not diving into
Yeah.
to CDC.
Or if anybody can help you with that, who has done the work?
Right. Well, I think that
Yeah.
the health care committee is doing that. I think what I
Okay.
took from our
Okay.
discussion on Tuesday night, we had a lot of discussion about vaccines and firearms on Tuesday night in
Yes.
the library. Was the question about exactly how does that medical exemption work when there has been an adverse reaction for a child.
Right,
Now, I believe,
right.
and I want to be really clear, I know that there's people in this room that disagree with me, but I firmly believe that vaccines don't cause autism. That said, I do know that some people have an adverse reaction to
There are many
to
other types of.
to a vaccine, and those
Yeah.
are two different
Yeah.
questions. But I also understand that with any medical procedure that we engage in, any medication that we take, we can never anticipate what all of the outcomes or adverse events might be with that. I might need an appendectomy, and I still have to sign the release that says I have an X% chance that if I do this, I'm going to have this negative outcome. And so it's always this balance of where's the risk. And I understand that that's what's behind
So
that
that's
question.
informed
but-
consent, and that involves consent. So, yeah, that's the thing that the exemptions, removing exemptions would take away.
Well, no, because you still don't have to get it. They're the consequences for school enrollment around public health, so that's where you get that tension. But we have to be really clear, there's nobody that is like forcing a needle
Well,
into someone.
you're
It's that
trading your
balance
right
of
to a
the-
public education for a right to decide what your medical
Right,
treatment.
you're balancing.
You're trading
You're
them
trading,
off.
you're
And they're
balancing.
both
values.
rights, they're both rights, right?
I need to know more.
Sorry, I'm uncomfortable, but okay, I will stop here, but thank you. I do appreciate your conversations on this with you.
Thanks for coming back.
Okay.
All right, we have a written question here. First of all, they want to say thank you for trying to improve the culture within the legislature. Can you discuss the legislation to counter Measure 11 on youth criminal justice reform, and what is the possibility of success?
So we have several really exciting criminal justice reform measures in the legislature this session, and a couple of them are the culmination of really years of conversation about how we manage youth offenders. So Measure 11 creates mandatory minimum sentences for certain crimes, and young people can be charged with these offenses. And some of the things that we are trying to look at, since we know that children and adolescents are still developing, and hopefully we take kids, they go to OIA after they have broken the law and engaged in a crime. We are hopefully providing them with treatment and services that are helping to rehabilitate them and help them develop in an appropriate and a healthy way. So what we want to be able to do is, as a young person is coming up through the youth authority and they have a Measure 11 crime that's going to cause them to then be transferred to an adult facility, that we have an opportunity with the courts to have a look back, to look at, is this still the appropriate thing for this individual, given how this individual has developed, the time since the crime. There's a lot that would go into that. So we're really trying to look at how do we have just a little bit more of a thoughtful response. There's a lot more that goes into some of these things. We have another bill that says we should not be putting kids in jail or prison for longer than adults for the same crimes, which I don't totally understand the mechanism of why that happens, but it's happening on occasion. We'll have that coming up in our Judiciary Committee again sometime.
Thank you.
I'm Tom Lewis from Albany, and I notice you are very protective of children in our system. However, you voted to require coverage for abortion, which kills children before they're born. Can you please comment on that?
I believe that abortion is health care, and that every person should make decisions with their physicians about their own health. I think every person has their own beliefs about abortion, and I believe that as a legislator, it's not my job to make those choices for other people.
But you still believe in forcing taxpayers to pay for it.
I believe that when there is a legal procedure for healthcare, that all people that have healthcare coverage should have equal access to safe and legal medical care that has been upheld by the Supreme Court. We shouldn't discriminate against people on the basis of health.
Well, it's certainly not safe for the baby, anyway.
And I'll also just ask everybody if we could hold applause or anything during questions, that would be appreciated. Thank you. I mean, we've already talked about campaign finance reform a bit, but I just wanted to, we have the majority of the questions here are on campaign finance reform. And so just wanted to give one more shout out to that question and see if you have anything. What do you think we can accomplish with campaign finance reform in this session? I guess is an overarching question.
So I'm really excited. For the first time ever, we have an actual campaign finance committee that just talks about that. Never had that before. It's always been in rules. Jeff Golden is the person that is running that committee, and that is pretty exciting. It's difficult because we do need to change our constitution. Our constitution really doesn't allow a lot of limits. It doesn't allow any limits at all to how we do campaign expenditures. So for instance, in my independent expenditure bill, I would like for, if somebody sends something out in somebody's district without their consent, I would like for it to have a statement that says, this was mailed without the knowledge or cooperation of X person. Under our Constitution right now, that is unconstitutional because that is forcing someone to say something that they don't necessarily want to say. So we as voters have to do that at the ballot, say that we can do some of these common sense kinds of things and put some limits on money. You know, Representative Rayfield is doing some exciting work around small donor elections and looking at how do we more empower small donors. I think the other way to get at that is to, I think the idea behind that is to incentivize the effort to go and spend time soliciting small donations instead of being focused on these very big donations. The other way to do that would be to be like other states, to change our constitution and allow limits, caps, so that nobody is pouring a ton of money into an individual. The Oregonian right now is doing a series of stories about environmental legislation and corporate donations to legislators. And I'm not all the way caught up, but the very first week of the series, they put up a database. And it was interesting because it had all 90 legislators that are currently there, and it looked at their campaign finance over the last 10 years. And I have always really, like Representative Rayfield, been very interested in smaller donations and just really building a broad base of support in the community. So when I ran for the Senate, I had over 700 individual donors that were people, not businesses or corporations. And because of that, in the list, there were 16 of us that have raised over $1 million over the course of the last 10 years. And I was kind of at the top of the list by percentage of number of individual donors and number of donations under $100. So even within the system that we have right now, and I was among the lowest for the corporate donations as well. So even in the system we have right now, we can do it. You can still raise the money if you're not going down that path. But we really need a system that incentivizes all of us to do it, because the fact is, if you're in a race and other people aren't taking those limits, it's like unilateral disarmament. So we need to create a level playing field for everyone.
Thank you. All right, Marge.
Hi, I'm Margie Stevens, and I'm quite interested in climate change and carbon dioxide in the atmosphere. I appreciate your support for House Bill 2020. I also wanted to bring to your attention another bill called House Bill 2618, which reinstates incentives for installation of solar on rooftops. We lost the residential energy tax credit a couple years ago, and this is a sort of a fix for that, to be able to help incentivize more rooftop solar. So I just want you to be aware of it, see if you had any comments or whatever.
I will look for it. I have not yet seen it since it's over on the other side.
Great. And also, if you have any additional written questions as we get closer, make sure you raise your hand. Let me read this one. We hear about issues around the country about students causing problems in classes that put other students and teachers in non-safe situations. Is this an issue in Oregon?
Hey, can you say the beginning of that again?
We hear about issues around the country about some students causing problems in classes that put other students and teachers in non-safe situations. Is there an issue related to this in Oregon?
I think those issues exist everywhere. Kids are coming to school with a lot more trauma and challenge than they have in the past. And we aren't always well-trained and equipped to manage those things. At the same time, when these kids come to school, we're putting more pressure on them than we ever have before. And I think we have been so focused on college and career readiness, driving all the way back down into preschool and kindergarten, that we've forgotten the kind of basic biological nature of little 5 and 6 year old boys and girls. They weren't built to sit still and do schoolwork all day. We don't have enough recess. We don't have enough PE. We don't have enough moving around and art and playing and engaging with other people. And you know, their little bodies don't know what to do. That becomes pretty explosive, and it starts a cycle of I get in trouble because I'm fidgeting and being really noisy, and then I lose my recess, which really doesn't help the situation. So I think we need to relook at the expectations that we're putting on little kids, and remember that we're not just building workers and scholars, we're building human beings. And that the part of kids learning about themselves, learning how to interact with other people, learning how to be good citizens is really important as well. In terms of behaviors, the other challenge is that our class sizes are really big. We have fewer specialists in our schools. So we have our counselors. It's hard to access enough counselors and behavior support specialists to kind of support teachers and helping kids manage those behaviors rather than escalating the behaviors. So we really need a lot more support within our schools. I was meeting with the superintendent at the Floma School District earlier this week, and they invested in a counselor, a therapist, for Clemens Primary School. Bringing that person in, consulting with all of their teachers, all of their behavior referrals went down 85%. All of them, big behaviors and little behaviors. And it had to do with that support both to the teachers and to the kids. And I think the Joint Committee on Student Success that's traveling the state is really looking at that as well. What are we doing in terms of the behavioral and emotional and mental health of kids and the support of teachers who are asking to manage all these things? Because they can't do 32 kids, a lesson, and help a child sort through a crisis while someone else is throwing their pencil at the wall. But our teachers really need a lot more help in order to get this work done. We've tended in the past to look at discipline to solve this problem. Do we exclude the kids from school? I talked about the issue of seclusion restraint, send the kids to the office. But all of those things are only a Band-Aid. And we kind of have to get to the root of the problem, because ultimately we need all these kids to be at school. Because if you're not there, if you're not accessing the lessons, you can't learn. Thank you. Welcome.
My name is Edie Orner, and I'm from Albany.
Hi.
And I want to ask about your reaction to Senate Bill 770, which is the bill which would establish a commission to develop a legislative plan that would bring universal health care to all the residents of Oregon.
I think it's great, and I think Senator Manning is a great champion. I loved the media that he put around it and all of his energy and the excitement. So I look forward to seeing it off of them.
Okay, well, I'm happy to hear that. We were hoping that you would become a co-sponsor, but understand that you're busy with all your other bills.
It's been busy, and we were never able to connect before it got dropped. So for whatever reason, with all the technology that we have, in order to sign on to bills, you still have to physically take a piece of paper and have the member sign. Their staff can't sign it. So and then you'll say, hey, Senator Manning, do you want to sign on to my bill? Sure. Oh, I don't have it. It's over in the house. I'll send my staff to get it. So connecting the right person with this, and they only let you use one single piece of paper. So it's not like you can send other ones out to everyone.
Well, thank you for your support.
We're going to go to another oral question, because unless people have another written one, we're at the end.
Hi, my name's Megan Ellitz, and I'm a student here at Oregon State University, and I know you are the chief sponsor on the 731 bill, and it's about student-elected organizations having a voice. And I just want to say thank you, and if you could talk a little bit more about it, and we appreciate your support as students. So, thank
Well,
you.
thank you for coming today. I think the bill has a hearing this week, or is it this week, the 11th? Time is going so fast, it's hard to keep up with all the hearings. But, so Senate Bill 731 came out of a series of conversations that I had with students last fall. Different student government organizations around the state were wanting to pass resolutions as it related to ballot measures. And they received some advice that even though they were elected on the campus and it wasn't using public funds, they might be prohibited from doing that because they were public higher education students. And by doing that, they could potentially face disciplinary proceedings. And this was, as you might imagine, upsetting for students. I think the universities were also frustrated because they were in a place that they had to provide that information to the students, but they also weren't trying to chill their speech or have them not participate. So we came up with a fix in discussion with the general counsel from Oregon State University and ASOSU that in the statute would clarify that student government representatives on Oregon University campuses that are elected officials for the purposes of speech. So they would be allowed to have conversations about measures and other kinds of issues. Could not use any public funds to do that, but just like I am, my staff is not allowed to talk about political issues on work hours, kind of taking positions on measures. I am not prohibited from doing, I can't use public resources to send you endorsements, but I can, it doesn't matter where I am, I can say what I think about a measure or a candidate. And that would put student government officials who are elected, give them that same freedom of speech.
Hi, welcome.
My name is Bill Kuhn. I live in Monroe, and Madam Moderator, thank you and the league for setting up these forums, and Senator, thank you for coming. I think of all the issues that are presented to us, the general public, the single one most important thing is protection of our homes and our families. So my question is directed to you with this in mind. Why would you, and this is SB 501, which I know is near and dear to your heart, why would you make laws that affect law-abiding citizens rather than the root of the problem, who are the criminals? Because criminals don't obey any of the laws, particularly firearm laws. So I feel that 501, among others, are directed at me, the law-abiding citizen, restricting my Second Amendment rights to protect my home and my family. Why not make laws that affect criminals versus me?
So thank you for that question. And to clarify, I would not classify Senate Bill 501 as near and dear to my heart. I'm not a sponsor of that bill. I didn't participate in it.
I apologize, I thought you were.
No, I am not
In any case.
not a sponsor of the bill. Senate Bill 501 has gotten a lot of attention. It was introduced at the beginning of the session by two members at the request of students in their district who had come to them to share concerns about gun violence at school. And so what this House member and Senate member said to the students was, if you want to go out and do research and draft a bill, we will introduce it for you. And that's what they did. The bill itself, I personally believe the bill had a number of problems. I would not have been able to vote for that bill if it had come up on the floor. It had some elements to it that I believe did kind of cross the line into a constitutional barrier. It had some parts that were impractical about the way that things are packaged. But I also think that, we have discussions and people introduce bills all the time. I have one, well, let me finish answering the question first. I have only one firearm bill that I have introduced this session, and it is Senate Bill, where is it? Senate Bill 481. And this bill is modeled off of a Washington bill where it passed either unanimously or nearly unanimously. And what it says is that in a case where an individual has had a stalking order or a restraining order, and as a result of that, the judge has ordered that they temporarily turn in their firearms. So law enforcement is holding their firearms until the expiration of that time is ordered by the court. that 24 hours before those firearms are returned to the individual, the person that was protected by that protective order is just notified that that person is going to be having their firearms back. They can't be told what kind of firearms, how many, they only get one notification, they're the only person that would be notified. But that is the only bill that has my name on it this session as it relates to
I
firearms.
apologize for saying that that was near and dear to your heart. However, some of the other issues related to that are that all of these bills make criminals, particularly 501, make criminals of law-abiding citizens the moment they're passed. Secondly, I serve my country. And anyone who serves their country takes an oath to protect and defend the Constitution of the United States and signs on so that they will sacrifice everything, including their life, to protect the Constitution. So if I'm an 18-year-old and I join the Marines and I'm trained as a sniper or an infantryman and I've been trained in multiple weapons and I come home to Oregon, I can't buy a weapon. I have a problem with that. I was once, believe it or not, 18 years old. By 19. That's not funny.
Yes, it is. What do you mean?
And I was overseas serving my country in a war zone.
Oh, boy.
It was not illegal for me. It was not illegal for me to buy a beer. Well, holy smokes. This is the same thing. This is not fair to restrict anyone 18 to 21 from buying a firearm. So most of these issues concerning firearms only affect law-abiding citizens, and I'm obviously very opposed to that and have been for some time.
Thank you very much.
I'm Lauren from Corvallis. Recently, the rent control bill passed. There are several others in front of the legislature to deal with housing policy. This would send Bill 10 to upzone blocks near mass transit. Other bills that would relax restrictions on what you can build in neighborhood zones for single-family homes, tax breaks for building new single-family homes or conversion to duplexes, bills to expand the urban growth boundaries. What's your preferred approach? Which of these, if any, do you support?
Well, obviously I supported Senate Bill 608 because I voted for it. We need a real blend of a little bit of everything. We need better protections for tenants. We need better access to capital so people can borrow money and purchase houses. We need improved supply, which means we need to look at how easy is it to build. We need better investment in affordable housing, which also needs to be a blend of rent subsidy and kind of help with homeownership. So I don't think that there's a single magic bullet that's out there. I think we have to look at how all of these pieces come together. And it becomes a challenge for Oregonians because we tend to have a lot of values in conflict with each other. So we have land use policies that we really care about and support because of how it impacts our quality of life and how it protects our farmlands and protects our environment. And we want more people to have affordable homes, and sometimes that's in conflict if we can't kind of use our land, if our land use laws restrict the spaces that we can do that. So I think we're in a difficult place that it's hard to say this is the solution, because bill by bill we have to look at what are the benefits, what are the trade-offs, what are the protections that are there. And I'm glad that we're finally talking about all the pieces at the same time.
Are there any specific bills before the legislature this term that you feel are part of the solution?
So I do not have the housing bills in my committee this session, and we have not caucused on any of those yet. So Senate Bill 608, certainly I'm very excited that we passed it through. I was really disappointed to hear from a constituent the other day who on February 28th received a notice that her rent was going to be increased by 30%, plus her landlord was going to stop paying garbage and sewage. So she's not going to be able to stay in that place, and the bill apply to her. Those are the types of abuses that Senate Bill 608 was designed to
One of my neighbors who was disabled was telling me about how there were too many no-cause evictions just to get rid of people like her, and that's now prohibited. But I hope that there will be some action taken this term.
Thank you very much.
I think we might be at our last question as we wrap up at 11:30 here.
My name is Dan Lindstrom. I live in Corvallis. Thank you for coming, Senator. And I do notice, I think I went to 2 last year where you were the only person answering questions. I commend you on that because I'm the last one. And mine is just a general, overall national thing, but it definitely relates to Oregon. And our president, if he tweets and twitters, if it offends someone, then everyone is against it, that it offends. Okay, so I support the president. But what I want to look at is January 30th of this year, 254 pounds of fentanyl came in with a load of cucumbers and was found in Nogales, Arizona. Okay, so that, drug technicians say that amount could kill over 100 million people if it was a lethal dose. Okay, so I want to say one more thing, that already in our nation we have drug distribution systems that would have dealt with that if it could have got to the unloading place. Okay, so what I want to look at in Oregon is when we say sanctuary city, sanctuary state, are we eliminating that sanctuary for Americans, as we get older, we have less appeal, less strength, and I just wonder, where is our nation headed when we aren't supporting simple things like the protection of our whole society on the sanctuary state? Did that make a question?
No, I think I hear what you're saying. I think I see it a little bit differently. It's one of those things where I think it's a false choice. I think we can all agree that we need to address illegal actions like a whole bunch of fentanyl in cucumbers. I don't know that story, but I do know I don't want any fentanyl in my cucumbers, and I don't want my kids accessing that either. But Oregon has been a sanctuary state for a very, very long time, and that protects a lot of people in our community that we don't even know who they are. They're people in your life and my life, and I think that protecting everyone means protecting everyone. That does not mean that people are not held accountable for crimes. What it does mean is that parents who might not be documented are able to go to their kids' parent-teacher conferences. It means that a victim of domestic violence is able to go to the court and get a restraining order without fear that someone in her family that is undocumented as a consequence will be sent away. It means that a young person that is graduating from Corvallis High School can apply for financial aid without being worried that that's going to trigger a deportation for a family member that's not documented. So I strongly support our continuing to be a sanctuary state. I don't believe it's the job of local law enforcement, who are already totally overwhelmed, to be doing the job of the federal government. And I worry that I don't think it protects the conversations that we're currently having and the actions of this administration as it relates to immigration, I don't think makes our country safer or stronger. It does not make other nations look at us with favor when we remove children and put them in dangerous places. It doesn't make sense to turn away refugees that are coming from places of violence to start a better, safer life. And that is what our history has been built on, and we've conflated that with criminals. And those are different sets of people. So I think we are protecting everybody by having sanctuary and prosecuting crimes when crimes happen, and not prosecuting people for just going about their daily lives.
Thank you. All right, kind of right on time here at 11:30. So first of all, this conversation doesn't end here. You always have the opportunity to attend town halls like this. Other meetings are ones coming up are April 6th and May 4th, the next two, and then June something that I don't have written down here, so find out about that. May 11th. Okay, we have it wrong on our newsletter. And I also want to put in another plug because I don't see Tony here again, but Representative Rayfield will be at Old World Deli on March 23rd at 9 a.m. So also, just a reminder that you, again, are always encouraged and invited to reach out to your legislators and their staff directly. So I want to wrap up by saying a heartwarming thank you so much to Senator Gelser. And to the League of Women and Voters for hosting this today for all of us. Thank you and enjoy your weekend.